Hi there, my name is Dr. Todd Austin, and I'm coming to you from Austin Family Chiropractic in Virden, Illinois, northern Macoupin County. I had an elderly gentleman this morning who's going through some back issues. He just had an MRI, found out he has some arthritis in his lower back, and is waiting to see a pain management person before he comes in to see me. He was asking me, he said some of the doctors that he's seen thus far had recommended water exercises or aquatic therapy, and he was wanting to know my take on that. So I think that's an excellent form of exercise. I have this conversation with my patients a fair amount of time here at Austin Family Chiropractic, especially elderly patients with low back issues or any lower body weight-bearing kind of issues, such as knee pain, hip pain, those types of things. So a lot of times the water therapy is very effective for them. It's definitely helps out, definitely helps in the recovery, definitely aids in the recovery. So it's an awesome form of exercise, aquatic therapy or water exercises, because it essentially neutralizes the effect of gravity on the body while we're doing those exercises because we're in the water. So that's kind of how that works. So it's good for back injuries and recovering from them. It's good for people with spinal arthritis. It's good for people that need to strengthen their core muscles. So it helps with core strengthening as we're doing the aquatic exercises, which in itself can prevent some back pain just from strengthening the core. It also helps to strengthen the muscles of the lumbosacral area, or the spinal lumbopelvic region, if you will. It also helps to decrease pain in a lot of cases by doing the exercise. So a lot of times we'll notice decreased pain while we're exercising, and then decreased pain will continue afterwards as well. Aquatic therapy or water exercises are also good for increasing our range of motion or flexibility in the low back area, low back pelvis area. Also, we'll see some elderly people that, because of different pain syndromes in the low back or the knees or the hips or whatever, they don't have as good a balance as they used to have in their younger years. And so sometimes water aerobics or water therapy, aquatic therapy, water exercises can sometimes help with assisting them to have better balance and better stability. So that's also another positive of doing the aquatic therapy. It's also a great form of aerobic exercise. So keep in mind, when it's aerobic, we're not only helping with the spinal health, helping strengthen muscles, things like that, but we're also helping with our cardiovascular health. So that's always good with aerobic activity. Also, another plus for the aquatic therapy is that sometimes we'll have patients that can't tolerate weight bearing very well for whatever reason. So those are people, keep in mind we're talking about the elderly population. If some folks that can't tolerate weight bearing well, obviously you're not going to send them out and say, let's do a stair stepper. You're not going to send them out of here and say, let's do a treadmill for 30 minutes a day, because those are high impact, and those are just high impact weight bearing exercises. Maybe the stationary bike would be a good thing for them, but the best thing would really, in my opinion, be some type of water aerobics or water therapy, aquatic therapy. So ideally, we want to look at some different things that we can do. One is just walking in the water, like waist deep at least, but it could be all the way up to, about your neck or below your chin. But ideally, be at least waist deep in the water, and just a normal walk in the water. So we're basically doing weight-bearing exercise, but because we're in the water, it really cancels out the effect of gravity, and we're able to do more than we possibly would otherwise, like on land, as far as the weight-bearing exercise goes. So it's a good way to get a patient to be able to do more than they would be able to do otherwise by using the water to assist. So we can just walk in the water. Now we do that, that's a good cool down. Afterwards, it's a good warm up before we do anything more vigorous as well. It's also something that in some of these places, like I know Fusion Aquatic Center in Hillsboro is a nice one. I think some of the YMCA's, like in Taylorville and Springfield, have these as well. But it's called a lazy river, and it actually has a little current in there. So if people walk in the direction the current is going, so they walk with the current, not against it, but with it, that's also another way that can help them walk a little quicker. So it just assists them in moving through the water quicker. And that's an excellent form of therapy too for some of these folks. They can also get into age-appropriate water aerobics classes as well. Those would be helpful. So those are just some different good things that aquatic therapy or water exercises can do as far as assisting people with back pain or with spinal arthritis. And I do want to say a little disclaimer here that before you watch this video and go out and attempt to do aquatic therapy, there are some contraindications, certain types of heart disease, if we have an active infection going on in our body, or if we have a history of certain types of seizures, then this may be contraindicated. So you definitely want to consult your physician first before you undertake aquatic therapy or water exercises. But I hope you've enjoyed this video. I hope you've got some good information out of this, and I hope that you'll tell others about my YouTube channel. And I thank you for watching. If you have any comments, please leave them in the suggestions below, or I will leave my email address in the description box below the video as well. So feel free to reach out to me by email or by leaving comments. And thank you for watching. Have a terrific day and happy exercising.